Listen, I'm about to save you thousands of dollars in physical therapy bills and years of unnecessary back pain. If you're over 65 and you've been told you need expensive treatments, complicated routines, or that back pain is just part of getting older, I need you to stop what you're doing and pay attention for the next 5 minutes. Because what I'm about to show you goes against everything the medical industry wants you to believe. 3 stretches, that's it. Just 3 simple stretches that take 5 minutes. And I've seen people in their 70s and 80s completely transform their lives. No equipment, no gym membership, nothing fancy. And by the end of this video, you're going to wonder why nobody ever showed you this before. Hey everyone, welcome back to the channel. If you're new here, I'm dedicated to helping people over 65 reclaim their mobility, strength, and independence through simple, science-backed methods that actually work. And today, we're tackling the #1 complaint I hear from people in your age group: chronic back pain. Now, I know you've probably tried everything. Maybe you've been to doctors who prescribed you pain medication. Maybe you've done physical therapy that cost a fortune and didn't really solve the problem. Maybe you've watched dozens of YouTube videos showing you 10, 15, 20 different stretches, and you feel overwhelmed, and you quit before you even start. Here's the truth that nobody's telling you. More isn't better. Complicated isn't better. What you need is targeted, effective, and sustainable. And that's exactly what these 3 stretches are. Before we dive in, make sure you hit that subscribe button and turn on notifications, because I post content like this every week to help you live your best life after 65. All right, let's talk about why back pain is so common after 65. Because if you understand the problem, you'll understand why these 3 stretches work so incredibly well. As we age, a few things happen to our bodies. First, our hip flexors get tight. Think about how much sitting we do throughout our lives: driving, working at desks, watching TV, eating meals. All that sitting shortens and tightens the hip flexors, which are the muscles at the front of your hips. When these muscles get tight, they pull on your lower back, creating a forward tilt in your pelvis. This puts constant strain on your lumbar spine. Second, our hamstrings lose flexibility. Tight hamstrings pull down on your pelvis from the back, adding even more stress to your lower back. Third, and this is a big one, our spinal mobility decreases. The joints in our spine get stiff, the discs lose hydration, and suddenly movements that used to be easy become painful or impossible. Now here's where it gets interesting. Most stretching programs try to address everything at once. They give you stretches for your calves, your quads, your shoulders, your neck, everything under the sun. And you know what happens? People get overwhelmed. They skip days, and eventually, they stop altogether. But research shows us that if we focus on just 3 key areas, the hip flexors, the hamstrings, and spinal rotation, we can eliminate up to 90% of chronic lower back pain in older adults. That's not me making up numbers. That's what the studies show. So let's get into these 3 stretches. The first stretch we're doing is the hip flexor release, and this is absolutely crucial. I want you to find a sturdy chair or the edge of your bed. Make sure it's something stable that won't slide around. You're going to stand facing away from the chair. Take your right foot and place it up on the chair behind you, so you're in a sort of lunge position with your left foot planted firmly on the ground in front of you. Your back knee doesn't have to be bent much, just enough so your foot is resting on the chair. Now here's the key. I want you to gently tuck your pelvis under, like you're trying to bring your belt buckle up toward your ribs. You should immediately feel a stretch at the very top of your right thigh, right where your hip flexor is. This might feel intense at first, and that's okay. That intensity is telling you just how tight these muscles have become. Breathe slowly and deeply. Don't bounce, don't force it. Just hold this position and breathe. I want you to stay here for 60 seconds. If 60 seconds feels too long, start with 30 and work your way up. While you're holding this, I want you to think about standing tall through your spine. Don't lean forward. Don't arch your back. Just stand tall and let gravity do the work. After 60 seconds, carefully step down, shake it out, and switch to the other side. Left foot up on the chair, right foot planted, tuck that pelvis, and hold for another 60 seconds. This stretch alone has helped so many people in my community reduce their back pain by half within just 2 weeks. The hip flexors are often the hidden culprit. and releasing them takes so much pressure off your lower back. All right, stretch number 2 is the standing hamstring stretch, and we're going to do this in a way that's safe and effective for your age group. I don't want you getting down on the floor if you don't have to. Find that same sturdy chair. This time you're going to stand facing the chair. Take your right foot and place your heel on the seat of the chair, keeping your leg as straight as comfortable. Your left leg, the standing leg, should be slightly bent. Don't lock that knee. Now, with your hands on your hips or resting gently on your right thigh, I want you to hinge forward from your hips, not your back, from your hips. Imagine there's a string attached to your belt buckle pulling you forward. Keep your spine long and straight. You should feel this stretch in the back of your right thigh, your hamstring. This is where a lot of people make mistakes. They round their back trying to touch their toes, and that actually reduces the effectiveness of the stretch and can strain your back. We don't care about touching your toes. We care about feeling that stretch in the hamstring. Hold this position for 60 seconds, breathing slowly and deeply. With each exhale, see if you can hinge forward just a tiny bit more, but only if it feels comfortable. Never force it. After 60 seconds, step back, shake out your leg, and switch sides. Left heel on the chair, right leg standing, hinge forward from the hips, and hold for 60 seconds. This hamstring stretch is vital because tight hamstrings directly attribute to lower back pain by pulling on your pelvis and changing the curve of your spine. When you release this tension, your pelvis can sit in a more neutral position, and that takes enormous pressure off your lumbar spine. Some people tell me they feel immediate relief after just one session of this stretch. That's how powerful it is. Now for the third and final stretch, we're targeting spinal mobility with a seated spinal rotation. Sit down in that same sturdy chair, feet flat on the floor, about hip widths apart. Sit up nice and tall. Imagine there's a string at the top of your head, pulling you up toward the ceiling. Take your right hand and place it on the outside of your left knee. Take your left hand and place it on the back of the chair or on the armrest behind you. Now, gently rotate your upper body to the left, using your hands as leverage to help you twist a little deeper. But here's what I want you to focus on. This rotation should come from your mid-back, your thoracic spine, not from your lower back or your neck. Keep your hips facing forward. Don't let them rotate with you. As you twist to the left, turn your head to look over your left shoulder. You should feel this stretch through your entire spine, particularly through your mid-back. Hold this position for 30 seconds, breathing deeply with each exhale. See if you can rotate just a fraction more. After 30 seconds, slowly return to center, take a breath, and then switch sides. Left hand on your right knee. On the back of the chair, rotate to the right and hold for 30 seconds. This spinal rotation is absolutely critical for maintaining mobility as we age. When your spine can't rotate properly, every movement becomes compensation. You're twisting from your hips, from your lower back, from places that shouldn't be doing all that work. By restoring rotation in your thoracic spine, you're distributing movement more evenly throughout your body, and that means less strain on any single area, especially your lower back. Do this stretch on both sides twice. So that's 60 seconds total per side. This entire 3-stretch routine will take you right around 5 minutes once you get the hang of it. So here's how I want you to use this routine. Every single morning, before you have your coffee, before you check your phone, I want you to spend 5 minutes doing these 3 stretches. Hip flexor release, 60 seconds per side. Standing hamstring stretch, 60 seconds per side. Seated spinal rotation, 60 seconds per side. 5 minutes total. That's it. No excuses. 5 minutes is less time than it takes to scroll through social media. And if you're really committed, do it again before bed. Morning and evening. 10 minutes total out of your entire day. Now let me tell you what you can expect. In the first week, you might feel a little sore. That's normal. You're waking up muscles and tissues that have been tight for years. Push through that initial discomfort. It's not pain, it's just your body adjusting. By week 2, you should start noticing real changes. Maybe you can bend down to tie your shoes without that sharp twinge. Maybe you can stand up from a chair without bracing yourself. Maybe you sleep better because your back isn't aching all night. By week 4, most people tell me their back pain has reduced by at least 50%. Some people tell me it's completely gone. And by week 8, you should have established this as a habit that feels as natural as brushing your teeth. The key is consistency. These stretches work, but only if you do them. I've seen people in their 70s and 80s completely transform their quality of life with this exact routine. People who couldn't play with their grandkids because their back hurt too much, people who had given up on traveling because they couldn't handle the physical demands, people who thought chronic pain was just their new reality, and they all proved that wrong by committing to these 5 minutes a day. Now I want to hear from you. Are you going to commit to trying this routine for the next 30 days? Drop a comment below and let me know. And I want you to come back in a month and tell me your results. Hold me accountable and let me hold you accountable too. If you found this video helpful, please give it a thumbs up. It helps more people find this content. Share this video with anyone you know who's dealing with back pain, because this information can genuinely change lives. And make sure you're subscribed with notifications on, because I'm constantly putting out content to help you thrive after 65. Remember, you don't need fancy equipment, you don't need expensive treatments, you just need consistency and the right approach. These 3 stretches in 5 minutes a day can end your back pain forever. Take control of your health. Take control of your life, and I'll see you in the next video.